Hi there, and welcome back to the Delivered podcast. My name is Athena Estelle, and I'm your host. I'm so glad that you chose to tune in with us today. I'm very excited about our guest. She is a physical therapist, which is very near and dear to my heart, obviously. She is coming to us with a lot of amazing experience. We're so lucky to have her. So join me in welcoming Dr. Kayla.
Thank you so much, Dr. Athena.
Yes, isn't that exciting? I love it.
Yeah.
That's awesome. So go ahead, give the listeners a little bit of background, when you graduated PT school, where you started, things like that.
Oh, absolutely. Okay, great. So I graduated from the University of Rhode Island with my doctorate in 2016. And right out of grad school, I didn't really know exactly what setting I wanted to work in. And as you probably can relate, the loan burden is often something that unfortunately drives us in a certain direction of where we work. And there are certain settings that are paying a little more. So my very first job was in a skilled nursing facility in northern New Hampshire. It was kind of one of the only job opportunities I had that would pay enough. So I spent like about a year there, and then an opening at the hospital near my parents and my boyfriend at the time opened up. So I went back home and started working in outpatient in a hospital, and also did a little bit of acute care. And unfortunately, again, the loan burden forced me to also work a per diem job in another skilled nursing facility. So I was very busy, but working really hard to pay off those loans. And then eventually COVID hit, and I had one of my grandparents passed away, and I was just like, okay, I need to kind of get out of here. So the world of travel physical therapy entered my life, and I went to Hawaii for 5 months. And I know, Oahu, and got the opportunity to be in a startup clinic. It was a pain clinic, and that was an interesting experience because there was no other physical therapist there. And yeah, it was a startup. So that was interesting, but I was in Hawaii, so you can't complain. And then eventually moved back home for a little bit. And then the travel bug hit one more time. And I went to Savannah, Georgia, worked in a skilled nursing facility down there just for the experience of travel. Finally came back home. I was like, you know what? I'm kind of sick of working for other people. So I started doing a little bit of physical therapy out of my home and just seeing like the local people working on standard like orthopedic issues. And then what really pushed me into a niche was my own personal experience. And I now do pelvic floor physical therapy. And the story behind that, quick story, is I'm someone who does not have children. I'm 33 years old, and I am very much into weightlifting, and often I do lift heavy weights. I learned how to start weightlifting in undergraduate. So it was 2012, 2013. And lo and behold, nobody back then taught women to brace their core differently than men. And so I started having a little bit of leaking with heavy lifting. I was like, what in the world is going on? And maybe you can attest to this too. In physical therapy school, the amount of women's health and pelvic floor physical therapy education or even, topic is very, very minimal. So I was a little bit humbled by the fact that I didn't know exactly what to do. And I went down the internet rabbit hole, Google searched everything I could. And I was like, okay, I think I have a little general understanding, but I need more. And it was so interesting. And, when you can take information and relate it to yourself, you get more inspired and motivated to learn more. So I signed myself up for my first Herman and Wallace course, which is basically the PT gurus of the pelvic physical therapy world. If you're getting into pelvic physical therapy, you should take their courses. So I took my first weekend course with them, and the rest is history. I am sold. I never, ever thought I would be in this little specialty. One of my coworkers at my orthopedic hospital job was trying very, very hard to get me to join her, and her efforts failed at the time. But I look back and I have a little bit of regret, so it had a great mentor. But here we are. I have my own practice called Empowered Physical Therapy. And yeah, we focus on pelvic floor physical therapy.
That's awesome. I think that's so cool. So then tell the listeners, I could describe it, but pretend like the listeners are a patient and you're going to kind of explain to them like what pelvic floor therapy is. Cause I feel like a lot of times patients will say to me like, what is that? And I'm like, okay, yada, yada. But like, how would you kind of break it down in just an easy to understand way?
You know what? I think that's a really great question, because what I have figured out in our area is that we aren't getting patients in the door because we are more in the awareness phase. Um,
Mm.
and so we're working really hard to get a lot of information out about what pelvic floor physical therapy is, what it can help with, and what you don't have to live with that has been, considered normal by society at this point in time for women and men too. Everyone has a pelvic floor. But for someone, the layperson who doesn't understand what pelvic floor physical therapy is, it's basically a specialized form of physical therapy that focuses on evaluating and treating the muscles, ligaments, connective tissue that support the pelvic organs, such as the bladder, the uterus, the rectum. It's this beautiful system that sits in the bottom of your pelvis. And some describe it as a hammock, but I think we're moving away from the term hammock because it doesn't actually cradle the organs. They more support and uplift. So, but that visualization is really nice for people. And as the physical therapist doing that, we also are trained in doing internal muscle assessments. So in order to get to this beautiful group of muscles with consent, we do often do an internal assessment.
Mm-hmm. Mm-hmm. Yeah, you hit the nail right on the head, like ding, like that was a great description. Cause I think, I have heard the hammock description before, but I think it's so easy for people to think. I mean, how many times in your life, and even as an adult, where people are like, oh, you're older, it's okay that you leak. Like, no, sis, I don't want to be 75, 80, 90, like maybe 90. I mean, but like, no, as long as I can prevent it, I don't want to have to worry about that. I think that's awesome. I will give Kayla and a lot of other people that do pelvic floor and do it correctly it is an extreme niche. It is extremely hard. There's a lot of knowledge because let's think about it like this. Okay. So for everyone who's not a therapist, just think about your body. Okay. If you break your leg, think about the muscles that you have to fix. You have your huge glutes, okay, your butt. You have your hamstrings, the muscle on the back of your legs. You have the quads. We're talking huge muscles. When you're talking about your pelvic floor, on someone my size, like my pelvic floor is a couple inches. You know what I mean? So like it takes a lot to strengthen those muscles and tone up those ligaments. I mean, I give you a lot of kudos. I think it's awesome.
Oh, you're so sweet. I appreciate that. And I mean, kind of the piggyback off what you're talking about is many other areas in the body we can palpate from the outside. We can see them from the outside. The pelvic floor muscles, we can't see them. You just have to kind of trust that they're there and honestly teach people to figure out how to find them and feel them. And that's one of the hardest parts.
Mm-hmm. Yeah, I think it all starts with the Kegel, right?
Yeah, that isolated pelvic floor contraction. That's the big word that most people know. Mm-hmm.
Yes. Yeah, that's a good place to start. Let's just start with that. So when you're explaining, to patients, we are going to retrain your muscles, whatever you're really differentiating for each patient. When you're trying to explain to them how to Kegel, what do you personally tell them?
Oh, these are some good cues. So it depends on if it's a person with a vagina or a penis, and so different cues depending on what their anatomy is. But we'll do the vulva and vagina person first. And so oftentimes I'll tell them these muscles are important for helping you stop urine, stop gas, and help you kind of contract around the vaginal canal. And so their mind's already thinking like, oh yeah, if I had to, go to the bathroom, I know what that kind of feels like to try and hold. So sometimes just saying that and using that cue is enough. But my favorite cue, and most people won't ever forget this one cue, is when it's a person with a vagina, I tell them, okay, envision this little blueberry sitting right on the outside of that vaginal opening. And what you want to do is try and pull that blueberry up into you without making blueberry jam. So no squishing it. So you don't want to do this all out maximal contraction. I know it's a good one and you will not forget it.
I will never forget the blueberry.
Because what happens is when people try to do that maximal contraction, all of a sudden they're using their glutes, their adductors, and all these other muscles that surround the pelvis to try and get this bigger contraction where it's like, we're trying to isolate, like you said, this very small muscle group. So yeah, oftentimes that cue helps. If the, holding back gas or holding back urine doesn't do it, those cues kind of help.
Okay. I love that. Now, would you say that's kind of the foundation, right? You have to kind of start with that, right?
Yeah. I mean, after the assessment, we might actually determine that that person is Hypertonic, and for the layperson, that's someone whose muscles have too much tone or they're too tight and they're just holding this contraction all the time. And that can be rooted in so many different reasons, like the muscles are weak, so their compensation is to tighten up. They have a fear of passing gas or like leaking, so they're constantly holding those muscles tight. So it might not be that they can't contract the muscles and tighten them. It might be that they can't relax and lengthen the muscle.
Oh, so it could be the opposite.
Mhm.
So when you have someone who's hypertonic, how do you get them to relax? Is it breathing?
Yes, nailed it. So I always go back to just breathing mechanics and making sure that the diaphragm, the abdominal system, and everything is working correctly so that when you inhale, naturally the pelvic floor muscles should relax and lengthen because your lungs are expanding and you're moving pressure downwards. And if you're met with a contracted, intense pelvic floor, then that's actually going to put more pressure on the organs. So you actually want those muscles in the pelvic floor to drop down as the diaphragm is also dropping down. So think of like a piston system.
Uh-huh.
So the diaphragm goes down and then the pelvic floor drops down and relaxes. And then as you exhale, especially if you do an active exhale, those pelvic floor muscles are going to come back up and contract a little bit as the diaphragm moves up in a way too.
Interesting. Okay. Then when you're doing your therapy, so after you've diagnosed if they're hypertonic, too tight, or if they're weak and they need to work on strengthening, when you're doing the exercises that they'll do as a patient at home, do you have them do the exercises in different positions, or is it different ways to do a certain exercise?
Absolutely. So similar to what you would do with any muscle group that's weak or having trouble, you want to put them in a gravity minimized position so that the gravity isn't putting more resistance or force down on the pelvic floor. So oftentimes we start in hook lying or side lying. In hook lying, for listeners who don't know, is on your back, knees bent. And then side lying is self-explanatory. But we start there and then we make sure they can do the foundational breathing. So that inhale and relaxing, the exhale and contracting. And once they've kind of mastered that and the rib cage mechanics are looking good, then we'll put them in more difficult positions like sitting up or standing, because then there is more gravity exerting down. And then after that, we move into different exercises like a squat or a deadlift or an overhead press. And then lastly, move into function or whatever kind of activities they're doing. Like if they're a runner or, they're just trying to go up and down the stairs or chase after their kid, jump on the trampoline. So eventually we just keep progressing to the level of activity that they're searching for.
I love that. So it is very similar to other types of physical therapy. It's just very, I don't know. I mean, I guess it's similar in the way that you're retraining muscles, but it's so different because I feel like it is so targeted. You have to focus on your diaphragm and your breathing, and then that affects this. It's like a Lego effect. It all builds together.
Yeah. And I think the big thing that our patients will say is like it's a big mental load in the beginning because you're concentrating and focusing and the coordination is just a lot. And they're like, didn't realize I had to focus so much on how to breathe. And I'm like, yeah, it's yeah. And that's the important part. Like that's kind of foundational for you. So we take a lot of time making sure those mechanics are sound.
That's awesome. Now, what is like the main population of clientele that you're treating? Do you have a lot of postpartum moms? Do you have a lot of athletes? Is it kind of like a mixed bag?
Right now, I would argue that we have more of the middle-aged, like perimenopause, menopause women. We've had a handful of men come through, so that's really cool. But right now, I would say our largest population is more the incontinence, the pelvic organ prolapse with the menopausal changes. But we do have quite a few postpartum people. We've been trying really hard to get pregnant women in while they're pregnant so that everything after the pregnancy will go more smoothly. So the more we prepare, like anything in life, the after is going to be better and easier, more predictable, and you'll just be more knowledgeable and then feel more empowered. And then, after the birth, we hope they come back. Honestly, we recommend every single person who has a baby to see a pelvic floor physical therapist, even if they're not having symptoms or don't feel like they need to, or even if their doctor says they don't need to, because we've had so many people later on, 6 months, 9 months, 1 year, 2 year, 5 years, and they're like, oh my gosh, I had my baby this long ago. All of a sudden, I'm having these incontinence issues or feelings of prolapse, or, I can't have an orgasm the same as I used to, or I have scar tissue from tearing. And it's like, yeah. So if we dealt with these sooner and earlier, or just even educated you on all these changes that could happen and how to manage them, then we could have mitigated much of that.
So let me ask you that. Right as you said that about coming to a pelvic floor physical therapist before birth, the first thing that triggered was, do you think that if you knew like the proper breathing techniques and how to control your pelvic floor, would that help you with pushing?
Yes. Because most
Yeah.
old school thought is that you use your pelvic floor to push the baby out, whereas you don't. Your pelvic floor actually wants to lengthen and relax and get the heck out of the way so that your uterus and your, unfortunately, very stretched out abdominals can help push down and out.
Mm-hmm. Yeah, that's really smart. I feel mad at myself that I didn't think of that when I was
You are
pregnant.
not alone, my friends. This is why we're in the awareness
Thank goodness.
phase, just trying to educate as much as we can.
Yeah.
Yeah.
And another thing that you said that something for me was that it can be delayed. Like for myself, I was a runner before Cecilia, not serious. I used to do like 10Ks. I was like the 10K queen. I ran through a bunch of them before her, but I noticed when she was maybe 18 months old, between 18 months old and 2, it was really weird. I was just running and I was like, I don't understand why I'm leaking. Like, what's going on?
Mhm.
So I kind of like self-treated it. Honestly, I probably need to go see one. I wish you were local. I would gladly come and be one of your patients. But I mean, I agree with you. I think it's something that I'd say 90% of the women that I know, it's something that they could use at some point in their life, either after a baby or, like you said, perimenopause or my mom's age. I mean, I'm lucky my mom's a physical therapist too. So we've talked about this as well.
Cool.
Yeah.
Nice.
Yeah. It's really cool. So, she has had friends that have gone to see those type of therapists. And I just think it's great. Like, why not?
Mhm. Yeah, it's so fun. You get someone in front of you, they've never heard of pelvic floor physical therapist, and then all of a sudden they're doing these things that they had no idea about and they didn't think they could help. And then they leave and they're feeling like, wow, life-changing experience, Like, oh my gosh, I don't need to leak anymore, or oh, I could have been doing this, or it's just the quality of life changes so much. And it's just such a fun topic. I just feel, so honored that I get the opportunity to do this for people.
Oh, I think that's really cool. Yeah, I agree. It's definitely a servant field,
Oh, yeah.
Yeah, literally.
Yeah.
So now when specifically with the postpartum moms, I think in general with physical therapy, a lot of people can think, oh my gosh, it takes so much time. Like, I don't want to do the exercises, or it's just because we're in such a rushed, busy society. And, I don't see that changing. But for the postpartum, now you also add a newborn. So you're not running around maintaining your life and working a full day and things like that, but you're probably running a house and now you have a newborn and you're trying to take care of yourself and not cry all the time. So for, just speaking about the postpartum, what is something that you kind of, I don't know, just use to kind of guide them? These are the important things I want you to focus on. If you get to this, awesome. If not, we'll work on it next time. Like, how do you kind of lay out that plan for them?
Yeah, I love that. So I think what you're kind of alluding to is this patient population is a little bit different than the standard person who doesn't have a brand new baby and they're trying to recover their own body. So try to keep it less, like 1 or 2 focuses each week so that it's not overwhelming, so they don't feel like this is extra burden, like they can't handle it. So in terms of like exercise and habits or lifestyle changes or posture changes, we try to keep it simple and not overburden. The other thing we find that's really helpful is if the person can't make it in to see us in the clinic because perhaps they're driving 30 minutes to come see us, and we do have hour sessions, but still it's like an extra hour out of their day, put the baby in the car, whatever. We do offer virtual sessions too, which has a lot of value in it because if we get to see the person in their home and how they're sitting when they're breastfeeding or bottle feeding or whatever they're doing, how they're bending over the crib to get the kid, like we can actually get way more information from a virtual at home like session than having them come into the clinic and just like, oh, let's try to simulate what you're doing. Yeah, so that's really nice for those folks. I think oftentimes if they're brand new, we'll go to the breathing basics because it's a gentle way to just kind of reconnect to the core, the pelvic floor. And then we'll do some posture awareness because as you probably remember, your posture changes quite a bit. Your center of gravity is way in front of you now as your belly expands. So we kind of keep it a little more simple in the beginning and then to just progress them individually as they are presenting and how they're doing.
I love that. That's great. Now, what would you say to those people? Obviously, like you mentioned, it does include an internal exam, which I think you explained very well. Those muscles they're sitting right at the bottom of the pelvis. So you have to get to them somehow. And they're not like the large muscle bodies that we talked about earlier. So for certain people, I know some people are extremely private and just in general. And then you talk about something like that. So I'm sure that there's people out there that have thought like, oh, I could really benefit from that. Or I want to fix this issue, but they're nervous. They're feeling nervous. They're nervous. It's their body. They don't know what it'll be like having someone in there. But what would you kind of say to either like ease them or encourage people to, try to like fight that to get the care?
Mm-hmm.
Or how would you kind of address that, I guess?
Yeah, I mean, obviously being sensitive is really important. And this person went through a trauma. Giving birth to a baby, whether cesarean or vaginal delivery, is traumatic. And everything your body went through is very traumatic. So honestly, we tell them you are in control at all times. Like if you don't want to do this, if you don't want internal exam, if you don't want me to look down there, we do not have to. It is something we offer. It is a complementary part of what we do, but it's not 100% necessary for them to make progress and to do well because we have models, we have visualizations and different types of ways of saying things to help them understand what we're trying to get them to do. So yeah, they're always the ones steering the ship, and we're just there to help guide them in whatever way they're comfortable.
That's a great analogy. Absolutely. So, what would you say is the most beneficial part about pelvic floor? I mean, we kind of touched on this a little bit, but from what you've seen with results in your patients, like what would you say is like the key?
If I were to think about every single type of person that comes in, like I said, we kind of see them in all walks of life. We even see kids sometimes. So yeah, people of all ages come in and they all have different issues. The pelvic floor is the connector from the lower part of your body to the upper part of your body. And it is the most important area that is the most underserved and like not thought about area. So sometimes you'll have a person who comes in, oh, I've had back pain my whole life. It is what it is. I've had x-rays. I've had this. I've had that. It's like, oh, well, has anyone ever talked about your pelvic floor or your breathing mechanics and how that all works? And can you find your deep core? And they're like, no, pelvic floor, what? That my back hurts, not my pelvic floor. It's like, that was the key. That was like the missing hidden gem that they've been looking for their entire life. And the same thing with hip pain. So it's just this beautiful connection point for so many parts of the body. And we've found a lot of success in helping people with regular orthopedic issues that no one has been able to really figure out on top of those other issues like incontinence and prolapse and pelvic pain and sexual dysfunction. So it's really cool once you hone into that area and use it as the key that's been missing.
Mm-hmm. I love that. Is there any, I don't want to say like tips and tricks, because this is like obviously a very niche subject, but when you're thinking about your patients and progressing them and things like that, is breath work really kind of like the bread and butter that you're really focusing on to build the platform off of?
That's a super big one, but I've done so much talking about it that I'll give you a couple others.
Okay.
One is drink your water. People are like, no, I don't want to, I leak. I'm like, well, when your urine is extra concentrated in your bladder actually gets a little annoyed. It's like, oh, I don't want this like nasty concentrated like stuff in here. So it starts to quiver. It's like, oh, get this out. So when you're dehydrated, you actually are at risk of leaking more. So we encourage people, our recommendation, so there's no real standard, but our recommendation is often drink half your body weight in water. And that can include if you eat fresh vegetables and fruits, or you have soup and tea, Anything that's not caffeinated, that counts towards your water consumption. So if you have someone who's 150 pounds, they're like, oh, 75 ounces of water, that seems like a lot. But it's like, no, it can add up based on your diet and what the other fluids you're drinking. The other one I really like to tell people is stop sucking in your stomach. I think that especially for women, and I can speak personally to it, is we want to have a really small belly. Like we don't want it to hang out. We're always holding it in, right? And unfortunately, what that does is as you're cinching right under your rib cage and holding that in all the time, you're just creating this constant downward pressure on your bladder, on your rectum, on your pelvic floor. So it can actually also contribute to issues in your pelvis if you're constantly cinching in at your waist.
Oh my gosh, I never knew that.
I know, it's a good one.
That's a great fact. Yes, I'm going to quiz my husband on that later. I bet I'll get it right too. Oh man, that's so good. Okay. So then, all right. So now let's kind of gear through like your postpartum mom's on the other side. She's doing better. She wants to get into weightlifting. So now we're kind of tying in like the weight, getting past the basic exercises. And now you're going to train them with some of those different lifts that you mentioned. So when you're getting into kind of the full body functional movements with the pelvic floor, are you contracting or relaxing your pelvic floor based on how you're lifting?
Yes. Yes.
Okay. Tell us about it.
So I guess that would have been another good tip is I tell people to exhale on exertion because in the beginning of this podcast, I said when you exhale, your pelvic floor will contract. So to support everything, if you can pre-contract or do something called the knack, the pelvic floor, and exhale as you're doing like the harder part of the lift. So for instance, with a squat, as you go down, you can inhale, you want your core to be a little bit engaged, but you inhale. And then on the way up, you exhale and the pelvic floor contracts. So that as you're doing the harder part or the pushing part of that squat, you're not going to be bearing down. And that's the same with like an overhead press. So as you're lifting the bar over your head, that's the exertion. So you're going to exhale, lift above your head.
So good. So how does that relate to running?
That's a little harder, but what we would do is we would start with just some really gentle things like going up on your toes and then dropping down onto your feet. So you inhale up on your toes and then exhale, drop down. So that you're doing the impact and you're contracting. You would progress that to maybe a jump with 2 legs, and then you'd go to single leg because running is single leg impact. So like skipping or hopping or just coordinating that pelvic floor contraction so that eventually like your nervous system is kind of doing it on its own.
Yeah, I love that. Now, when you're getting your runners back into running after the pelvic floor program, do you ever have them do like a walk run situation, or do you just tell them like have at it and pay attention? Or
no, walk run is a great idea. Just like anything, like if they had a knee injury or hip injury or back injury, yeah, you want to kind of test the waters. And like any muscle you work on, there's the endurance component, there's the quick contraction component, the coordination component. So most people will get that quick contraction back quicker, but to sustain that over time, the endurance takes longer. So yeah, I would do walk 5 minutes, jog 1 to 2 and see how that goes. Okay, great. Then we can change it a little bit like, okay, now you're going to walk for a minute, but jog the 5 minutes or what have you. And just, yeah, gauging the response and seeing what happens and slowly, like any other muscle group, work up to the endurance being better.
Okay. That is so great.
Yeah.
That's awesome. All right. So go ahead and tell the listeners how they can find you on Instagram, how they can reach out, your website, give them all the goods.
Yeah, great. Thank you so much. So Instagram, we are empowered_physical_therapy. That's the business one. But if you want me personally, it's Dr. Kayla _empowered PT. And then on Facebook, Kayla Matuszewski. It's a very unique last name and probably pretty easy to find. You can definitely add me as a personal, or you can go and search the groups. And we actually have a group on Facebook. It's called Empowered Physical Therapy. And the main goal of that group is just to get out information to people, support people in the group. They ask questions. If we have classes going on or whatever, then you're the first ones to kind of hear about it. So that group is really cool. Sometimes I'll do live Q&As or just live info sessions where people can come in or join on a 7 o'clock on a Thursday and ask me questions. So that's a fun group. And then our website is empoweredphysicaltherapy.org. We have a little contact sheet. Really, you can email us or email directly at empoweredpt22@gmail.com.
That's awesome. Now, let me circle back to one more thing just for our people who are not up in New England. Do you do virtual?
Yes. Yes.
Okay.
Yep.
Okay. So keep that in mind, listeners. If you want, you could always reach out with questions, fill out the contact sheet, get more information, and definitely set up something virtual.
Oh, yeah. I know. Honestly, I just enjoy helping people. And if you send a question to me and you just want advice on something or guidance or direction, like super easy, reach out anytime and just ask the question. I'll answer you as soon as I can, of course.
I think that's awesome. And then our last question, I do this on every episode, it's my favorite thing, is if you could describe your profession in one word, what would you say?
Oh, man. Athena, there's so many, but
I know.
I think the one that stands out to me right now is transformative.
Mhm.
We are so lucky to just be part of people's health and wellness journey in so many ways, but mostly in a way that changes their lives. We're in a really unique position where we can do it naturally and in a whole body approach too. So to help someone stop worrying about leaking or have pleasurable sex again, or no longer have pelvic pain, or they're not worried about their organs falling out of them, it's like we literally help them transform their life.
That's powerful, girl. I love that.
Thank you.
Oh,
Yeah.
that's awesome. And I just feel like your energy and your personality, like you can tell what a passion this is for you. I lied. We're not done. I have one more question. So, empowered, I should have asked you that. How did you come up with that? I love it.
So thank you. I absolutely love that too. And it took me a long time to think of the right word, to be honest. But at one point, I was just like, yeah, that's the right word for us. And basically, it stems from recognizing that unfortunately, the healthcare system has let people down, particularly women, in my opinion. And I feel like the business model we have and what we're doing and how we have like a free Facebook group and all the information we're trying to get out there, our goal is to empower people to take control of their own health and wellness and be an advocate for themselves because now they have more information and they know more things. So, yeah, feeling empowered in that way, in knowledge, and then being empowered in your own body after because you feel stronger, you feel better, you're not leaking all those things that we talked about. It's just the right word. Yeah.
Yeah. No, I love it. I think it's great. It's awesome. It's powerful. Obviously, that's part of physical therapy, like just physical therapy. And then you add the pelvic piece and like you said, all the different changes with life. And I love it.
Mm-hmm. Yeah. Thank you.
Yeah. I'm so glad that you joined us today. This is another perfect example of where social media can just be such a blessing in such a crazy society that we live in. And there's so much madness and
Mhm.
crazy things going on. But I think it has, I'll use your word, empowered me because I have never sent so many DMs in my life. And it's very nerve wracking, even when it's to a female.
Yep.
But, you just have been so fantastic. I think what you're doing is great. I'm so glad that you decided to join us today. I'm super thankful for you and for your time.
Yeah, likewise, Athena. I mean, honestly, I wouldn't have been able to do this unless you started this podcast and opened it up to me. So you deserve just as much credit.
Oh, thank you. I
Mhm.
appreciate that so much.
Yeah.
Yeah. Well, thank you so much again. And we'll be in touch. I'm sure I'll have questions.
Yeah. Bring it on anytime.
All right. Thank you so much for listening. We'll catch you next week.